Let's discuss REN3, a front mu point or an alarm point. REN3 is located on the anterior midline, one zone superior to the upper border of the pubic symphysis, or fourth zone inferior to the umbilicus. How to find REN3? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 zone. As this can vary considerably from the patient's finger zone, only proportional zone measurement should be used here. So a helpful device would be an elastic tape. Locate REN3 on the midline. One zone superior to the midpoint of the upper border of the pubic symphysis. Located on the same level are kidney 12, which is 0.5 zone lateral to the midline, and stomach 29, 2 zone lateral to the midline. Needling of REN3 is vertically 0.5 to 1 zone. Caution, peritoneum, bladder, contraindicated during pregnancy. Ask the patient to void the bladder before needling. Actions or indications of REN3. Benefits the bladder, drains dampness and damp heat, dispels stagnation, benefits the lower burner. REN3 also regulates menstruation, strengthens the kidneys. REN4 is more commonly used for this purpose. Special features. REN3 is the front mu point of the bladder, the meeting point with the liver, kidney, and spleen channels. Important point for disorders of the urogenital tract, with its main action on the bladder, especially for acute cases. REN3 is a very important point for genitourinary problems. It is the main point to affect the bladder and its function of Qi transformation. It can therefore be used for any urinary problem, particularly acute ones. It is more frequently used with reducing method in excess patterns. However, it can also be used with reinforcing method to strengthen the bladder. REN3 is specific to resolve damp heat from the bladder and is used for symptoms as pain and burning on urination and interrupted flow of urine. It clears heat from the bladder and is usually combined with some distal points for fever, burning on urination, and blood in the urine. To treat these problems, REN3 is often combined with spleen 6, spleen 9, or liver 5, depending on the presenting pattern. REN3 also affects the uterus and menstruation, and it can be used in many menstrual irregularities, both to consolidate and strengthen the directing vessel, or the renmi, and to invigorate blood in the uterus for painful periods, retention of placenta, abdominal masses. REN3 also has a general tonic effect on the kidneys and the original Qi. REN3 is used for excess rather than deficiency patterns, and more to invigorate blood and resolve dampness than to nourish blood. So for deficiency patterns, we recommend that you use REN4. To summarize, REN3 resolves dampness from the lower burner. So this can benefit those with genital itching, pain in the genitals, excessive vaginal discharge, hernial and genitourinary disorders. REN3 promotes the bladder function of Qi transformation. So this is very effective for urine retention, frequent urination, dark urine, and pain on urination or dysuria. REN3 benefits the uterus and regulates menstruation. So this can benefit infertility, irregular periods, amenorrhea, excessive bleeding, abdominal masses in women, retention of placenta, retention of lochia, and persistent lochial discharge. REN3 strengthens the kidneys and nourishes the essence. So very helpful for lower backache, dizziness, tinnitus, weak knees, deficiency of yuan qi. REN3 is the front point of the bladder and the meeting point of the conception vessel with the spleen, liver, and kidney channels. The term mu means to gather or to collect, and the front mu points are where the qi of the Zang-Fu gathers and concentrates on the anterior surface of the body. REN3, therefore, has a direct action on the bladder fu. Urinary disorders characterized by retention, pain, frequency, and urgency of urination may be excess or deficient in nature. Excess patterns include accumulation of dampness or damp heat and stagnation of qi, and may be complicated by the presence of stones or bleeding. Deficiency patterns primarily involve deficiency of qi and yang due to its ability to regulate qi transformation function of the bladder, drain dampness and heat, and strengthen the kidneys. REN3 is a primary point in the treatment of urinary disorders involving any of these disharmonies. In clinical practice, REN3 is favored for excess patterns, whilst REN4 is favored for deficiency patterns. By virtue of its ability to promote smooth urination, REN3 is also indicated for edema. The ability of REN3 to drain dampness and heat extends to the genital region, where it is an important point for itching, swelling, and pain, as well as leukorrhea and seminal emission. The Great Compendium of Acupuncture and Moxibustion recommends REN3 for pain and swelling of the cervix. The spleen controls the blood, liver stores blood, and the kidneys and the conception vessel dominate uterus and conception. REN3, as a meeting point of all these channels, is able to regulate the uterus and menstruation, and is primarily indicated for excess patterns, giving rise to abdominal masses, irregular or absent menstruation, infertility, and especially retention of the placenta or lochia. The three Legian channels of the spleen, liver, and kidney, they all pass through and dominate the lower abdomen as a meeting point of the conception vessel. With these three channels, REN3, therefore, has a strong action on the lower abdomen as a whole, predominantly in excess patterns involving stagnation and accumulation of cold or heat. It is indicated for masses, Shan disorder, and severe twisting pain, and both hot and cold sensations in the abdomen. REN3 is also used for running piglet qi, particularly when due to kidney yang deficiency with invasion of cold. According to the essentials from the Golden Cabinet, running piglet disorder arises from the lower abdomen. It rushes up to the throat with such ferocity that the patient feels he is close to death. It attacks and then remits. It is brought about by fear and fright. REN3 is indicated for deficiency of yang qi and lower origin or yuan deficiency. However, so great are the tonifying properties of REN4 that in clinical practice, REN4 is almost invariably used for this purpose. Like REN4 also, REN3 is indicated for lumbar pain, reflecting the principle of selecting points from the front of the body to treat the back.